Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everyone, and welcome to episode 214 of the Better Health Guy blogcast series. Today's guest is Dr. William Davis, and the topic of the show is supergut. This is part 2 of our conversation that started in episode 213, where you'll find his bio and more details about Dr. Davis. In episode 213, we talked about the microbiome, about several beneficial organisms, as well as about prebiotics and polyphenols and the mucin layer. In this episode, which is part 2, we're talking about SIBO, SIFO, and creating the supergut yogurts, which I'm just beginning to do myself. And now part 2 of my supergut interview with Dr. William Davis. So we're going to talk now about SIBO and SIFO. SIBO really is an umbrella term. The terminology is changing. We have the methane-dominant SIBO now being called IMO, or intestinal methanogen overgrowth. Wondering if these concepts that we're talking about with your program, with the yogurts, do they apply to all 3 types of SIBO: hydrogen, methane, and hydrogen sulfide?
Well, here's what I'm thinking. This is maybe an evolving thing that, if we looked at the microbiome composition, say, of some of those hunter-gatherer populations, they often have more methanogens than we do. Now, the hallmark of methanogen overgrowth is constipation, and they're not constipated. So is the problem methanogen overgrowth, or is the problem the context they occur in? In other words, methanogens in those people doesn't seem to cause any problems. Methanogen in us seems to cause constipation, maybe some other problems. So I'm not convinced that methanogen overgrowth per se is the problem. There are ways to eradicate methanogens or reduce their population. You could use Xifaxan with neomycin. You could use the Candibactin ARBR, herbal antibiotics. But what I've been suggesting to people is, all right, there's no rush here. Let's do all the basic things we do in the microbiome. Fermented foods, Reuteri, gastrite, subtilis, fermented foods. Let your gastrointestinal tract heal, and I think the methanogen issue will go away. Will correct itself. And this is anecdote, Scott, just pure anecdote, but I think it works.
The organisms in SIBO are often in the Enterobacteriaceae family, which consists of many different bacteria. So wondering, what are some of the more common bacteria that we see in SIBO? And then do you find that these organisms are better treated with rifaximin or Xifaxan? Unfortunately, I've seen some people that have been on those for years because every time they stop, things come back. Or do we find that the herbal natural interventions like you mentioned, or oregano or berberine, do we find that those are generally good tools that can often help us to avoid the pharmaceutical interventions?
Those Enterobacteriaceae or proteobacteria, those are fecal microbes: E. coli, Klebsiella, Proteus, Pseudomonas, Enterobacter, Citrobacter, on and on. There's tons of them. Those things are very toxic, of course. So as I mentioned, what we've been doing is, ask, if you had SIBO or just colonic dysbiosis and you have a dominance of those fecal microbes, the Enterobacteriaceae or proteobacteria, if you just took an off-the-shelf probiotic, will it go away? No, almost never. So what if instead we chose microbes that colonize the small intestine and colon and produce those bacteriocins that kill most of those species? So far, it has worked like Scott, I did not expect this. I thought I just tried to help people get some relief. No, so far, with the assistance of the AIR device, about 90% of people will normalize their hydrogen breath measurement in people who have the device. So, and you know what? If I said, Scott, the solution for this is surgical removal of part of your gastrointestinal tract, like a small bowel or you would say, well, damn it, you better be confident that's true. But what if the solution is something that looks and smells like yogurt that you make in your kitchen and gives you smoother skin, higher testosterone, youthful musculature, amplification of the immune response, better social behavior? Well, maybe you don't have to be so confident that you have this or not. And it's been working far beyond my expectations. We will validate this in a clinical trial. Kind of hard to do because people are doing it with yogurt. We can't have people using yogurt in clinical trials. But I'll try to validate this in a clinical trial down the road. But so far, that has worked without having to resort. Now, the only times I see people do better with some kind of antibiotic preparation, whether it's Xifaxan or one of the herbal antibiotic regimens, is if you have really bad histamine intolerance or brain fog, because those are made worse by those microbes, by Lactobacillus rhodori and gasseri. Not because the microbes are dangerous, but because you're so bad that histamine is a normal signal molecule. So it's not like you don't need histamine. You do need histamine, but Lactobacillus rhodori causes histamine production. And so you may not tolerate it at first. So you may have to eradicate or reduce those populations of the Enterobacteriaceae at first, then introduce. But those are the exceptions. Those people are the exceptions.
No, and I think in this listener community, there are a significant number of people that are dealing with mast cell activation syndrome, histamine intolerance. So I think that is very relevant, what you were just talking about, that maybe using the antimicrobial herbs first to help reduce those organisms that might also be contributing to that histamine intolerance. And then later, hopefully that increases their ability to tolerate the yogurts to kind of move to the next level, is what I'm hearing. You say in the book that 25 to 67% of people with Parkinson's have SIBO. There's a 5-fold increase of SIBO in those with Alzheimer's. In the case of Parkinson's, there's some research around D-sulfovibrio as a potential cause or contributor through its impact on alpha-synuclein. We know that D-sulfovibrio produces hydrogen sulfide. So I'm wondering, what is the prevalence of SIBO in the general population, and can balancing our microbiomes reduce the potential for the later development of neurological conditions like Alzheimer's, Parkinson's, MS, maybe even ALS?
We do lack intervention studies. That would be the final frontier where we do something specific for the microbiome, say in a Parkinsonian population, and we see some improvement. My friend Martha Carlin, who I've mentioned, of BiotiQuest, her husband had Parkinson's disease. So she crafted a mixture of microbes that consume glucose, Lactobacillus plantarum, leuconostoc mesenteroides, Lactobacillus rhodori, and a product she calls Sugar Shift. But she did that because that converts that collection of sugars to mannitol. And there's in vitro evidence, so test tube type evidence, that mannitol can cross the blood-brain barrier and dissolve the alpha-synuclein of Parkinson's disease. And she has not yet had a chance to do a clinical trial. She suffers from the same limitations we have, that is, we're not pharma. But anecdotally, in her fairly significant Parkinsonian population, she saw partial remission. She saw her husband, for instance, go from walker dependent to walking freely. So there's that. But we really lack intervention evidence in all these neurological conditions. There's clearly something beyond the microbiome. I think the microbiome is a major player in all those neurodegenerative conditions, Parkinson's, Lou Gehrig's disease, dementia, et cetera. But there's probably something else here. Like with dementia, there's the issue of omega-3 fatty acid depletion. There's heavy metals. There's glycation of neuronal and glial proteins. So I wouldn't say that the sole solution is the microbiome, but the microbiome, I think, is a major player. We also have to accept that the current methods to detect SIBO especially underestimate how many people have SIBO, because hydrogen gas, if you have methane overgrowth, for instance, or hydrogen sulfide overgrowth, it will conceal hydrogen gas because the microbes take hydrogen gas to make hydrogen sulfide or make methane. So it can, if you test positive for hydrogen sulfide or methane, you also have hydrogen gas producing SIBO, even if the hydrogen gas level is low. So those are, or if they do an endoscopy and aspirate some of your duodenal or jejunal contents, you have to have SIBO really bad And they're going to culture it. And culture does not reveal the species of SIBO. Sometimes it does. It often does not. So there's a lot of problems with identification of SIBO right now.
My understanding is that your friend Martha at Biotic Quest also has a yogurt starter product as well. So another interesting tool for us to explore. What about kids with autism, PANS, PANDAS, where maybe some need a delactate-free probiotic? Can they use and tolerate the yogurts? What have you seen in kids on the spectrum where we know their microbiome is a very significant contributor to their condition?
As you know, autism is a very complicated topic. I have seen, so we have several clinical trials where these kids were given intranasal oxytocin. So one of the ways that Realize works is by provocation of oxytocin release, the hormone of engagement, eye engagement, sociability, those kinds of things. So because autistic kids have problems with those social behaviors, they were given intranasal oxytocin, which is kind of offensive. It's a nozzle up your nose, these kids' nose, 3 squirts per nostril every 6 hours. So it's one, the mode of administration is offensive, and there's probably not a lot of systemic effect. But there's some evidence to suggest there's a modest improvement in behavior. So just oxytocin alone is insufficient to address it. Now, this is pure anecdote, Scott. I've had a lot of moms who have given their kids Realize, and they've seen not cure, of course not, but marked improvement in behavior, socialization, going to school, getting a job. I've seen this now a number of times. I don't know how consistent it will be because it's not a clinical trial, it's pure anecdote. But I think the endogenous oxytocin that we get presumptively from the restoration of Realize is different than intranasal administration of the oxytocin. Now, I don't know if we're going to be able to do that clinical trial in autistic kids. It's a complicated thing to do. But it's just yogurt. There's nothing to lose if you can get your child to consume the yogurt. But I have heard of some very dramatic effects.
My perspective on SIBO is that while we do have microbial overgrowth, I think it's often more downstream from things like nervous system dysregulation, migrating motor complex, bile flow. So I'm wondering if you think that long term, we can fully resolve SIBO with a sole focus on killing or removing a microbe or even restoring microbiome balance with the yogurts? Or do we also need to look upstream to maximize that long-term resolution? And if we consider the overgrowth itself to potentially be the result, what do you view as maybe the more upstream causes of SIBO or root causes of SIBO?
There's so many causes, some of which we probably don't even know about. So exposure to antibiotics, food preservatives, probably lack of sunlight, that is the infrared wavelengths on the abdomen. That may be a major influence. The loss of stomach acid in people with hypochlorhydria or taking PPIs, stress, emotional stress can do it. Other drugs can do it, non-steroidal anti-inflammatory drugs. Of course, antibiotics can do it. And there's probably things we're not even knowing. Does EMF do it? Don't know. I'll bet you it does, but just don't know. But I will tell you this. So I work my programs in the context of everybody giving up wheat and grains. That's a given. Well, when you do that, you've eliminated gliadin-derived opioid peptides. Those are the things that derive from the gliadin protein in wheat and related proteins in other grains that stimulate appetite, but also have an opioid effect on slowing intestinal propulsive activity. And that's why some of the worst constipation you'll ever see is in people who eat wheat and grains. Paradoxically, ironically, they're told, eat more fiber, like bran cereal, which makes it worse, or it provides bulk at best. So in my programs, people have all gone wheat and grain free and thereby are freed of gliadin-derived opioid peptides. So we don't tend to see that slowed propulsion that other people are seeing. So I'm wondering if they're calling it something, but it's really opioid. You'll see this, of course, people on Oxycontin and morphine. They'll be miserably constipated because opioids are very constipating. The other thing we do is address magnesium. So as you well know, magnesium deficiency is rampant because it's not in the magnesium content of produce is miserable now. And of course, we have to filter our water, our drinking water. because it's got herbicides, pesticides, pharmaceuticals, and farm runoff and fecal matter. So we have to filter our water, and water filtration is very effective in removing all magnesium. And magnesium depletion, one of the effects is slowed propulsive activity in the GI tract. So we restore magnesium. So I'm not seeing that thing that people talk about, the migrating motor complex disability, and I'm just not seeing it. Maybe it does happen, but I'm not seeing it.
So, Dr. Greg Nye, another very interesting practitioner, he has the theory that SIBO may actually be a response to sulfate deficiency, and that the hydrogen sulfide then overgrows to try to compensate for sulfate deficiency, and often will suggest using Epsom salt baths to restore both, obviously, the magnesium, but also the sulfate. I have heard some practitioners suggest that they think overconsumption of probiotic supplements could itself be a contributor to SIBO. Wondering if you think there's any possibility that intestinal overgrowths could be more problematic with the overuse of commercial probiotic products.
I think if someone just blindly adds a probiotic and has an adverse effect, diarrhea, bloating, mind fog, that's the D-lactic acidosis, they're probably making things worse. Or the probiotic is starting to cause a die-off reaction, is killing off some of those fecal microbes, and you're just getting a die-off reaction. So it's kind of a mixed bag of phenomena. So my preference would be that you prepare by doing all the things we talked about, cleaning up your diet, getting vitamin D. So the basic nutrients I address: vitamin D, omega-3 fatty acids, magnesium, and iodine, because those four things synergize to increase intestinal propulsion and also minimize insulin resistance. And then do that, clean up your diet, and then and take some basic steps to rebuild your microbiome, fermented foods, keystone microbes. But if you get sick doing those kinds of things, that's a really good sign you got SIBO really bad. And maybe you're a person who can get rid of it with the SIBO yogurt, the microbes that colonize the small intestine and produce bacteriocins, or maybe you're that person who's got to take the herbal antibiotics or even Xifaxan first. But this notion that probiotics cause, I've heard people say that. I've never seen evidence of it. So there's a clinical trial where it was shown that D-lactic acidosis is caused by people who take probiotics, and the conclusion was probiotics therefore cause SIBO. And that was an unjustified conclusion. You cannot make that conclusion that if you have an adverse effect of a probiotic, it must therefore cause the SIBO. No. I think a better interpretation would be if you take a probiotic or a prebiotic and you have brain fog or other adverse effect, the problem is not the food or the probiotic, it's your SIBO, and address that first.
So when we were talking about SIBO, you had suggested that we generally probably can do well with the yogurt unless we maybe aren't going to tolerate it because of histamine and mast cell issues, in which case we might then use some herbs. Is that the same in SIFO, where we can jump then into the yogurts? Or when we're talking about fungal overgrowth, do we first need to weed the garden before we plant new seeds?
Yeah, though the evidence doesn't bear this out, it's always been my belief that if you have SIFO, you probably have some measure of dysbiosis or SIBO, because bacteria suppress fungal overgrowth. So I got to believe that fungal overgrowth was invited by a disruption of the bacterial populations. But as we talked about, I tend to try to get away from treating things. If you got something, kill it. That's it. Fungal overgrowth is the exception. And that's because all the things we're doing, while they may help suppress fungal overgrowth, they tend not to kill the fungi. And you don't have to eradicate fungi altogether, but you have to reduce their overpopulation if they're overpopulated. That requires specific efforts. So berberines are really good antifungal, which, by the way, brings up an issue. People say, I'm going to take berberine for my blood pressure or my blood sugar or some other application. Well, that's a really bad idea because berberine's antibacterial. It's like an antibiotic, and it kills off, for instance, Lactobacillus rhodori and Lactobacillus gasseri. It's indiscriminate. And so it's like the NAC. Yeah, use it for maybe a few weeks to kill off your Candida species or your other fungal species, but don't rely on it chronically, even though it may reduce. Why does it reduce blood glucose and blood pressure? I think because it's reducing endotoxemia and SIFO. And so, but the SIFO requires specific effort. So berberene's a really good choice, 400 to 500 milligrams twice a day. Some of the commercial products, like the Candibactin BR, is a good product. The essential oils, the food-sourced essential oils, oil of oregano, clove, cinnamon, diluted. You must dilute them because they're very caustic. So like 3 drops or so in a tablespoon of extra virgin olive oil, avocado oil, some oil, a couple times a day. I will tell you, listeners, that fungal overgrowth die-off is really rough. Depression, panic, anger, hatred, don't drive. You're going to have a lot of road rage. So if it becomes overwhelming, back down. Reduce the dose or frequency of the berberine or the Candibactin BR. Reduce the dose of your essential oil and do it over an extended period. So rather than 3 or 4 weeks, maybe longer, or do it, a few weeks, break, do it again. Fungi are very good at generating resistance and hiding in their biofilms. In the hospital, when we had fungal, like Candida infections of prostheses, of a heart valve or a prosthetic knee or hip or other device, it's a nightmare because you give people these big guns like amphotericin B. We called it amphoterrible because we knew it'd make you sick as a dog, probably wipe your kidneys out, and you have to have the appliance removed surgically. And that's because the Candida was so good at making its own biofilm, the antifungals could not penetrate. So the fungi are little bastards. You have to that's where the NAC may be helpful.
And I'm assuming you're talking there about IV amphotericin, because we do use amphotericin orally for fungal colonization and don't seem to see significant side effects. So is that more IV application that you're talking about?
More IV.
Yeah. Is it reasonable to think of our microbiome as only having so much real estate? And if we can then reduce the bad guys in the microbiome, we kind of create more space or more real estate for the beneficial organisms to then proliferate?
Yeah, good perspective. I hadn't thought about that, Scott. That is, it is a limited space. It's only 30 feet, maybe a couple inches across at most. You're right. So if you have an overproliferation of, and it doesn't take much, by the way, those Enterobacteriaceae or proteobacteria you're talking about, if they're supposed to be around, I might be a little off in the numbers, if they're supposed to be just fine, if there's only 1 or 2% of the total population, but they rise to 8%, you can be very sick because they're going to have all kinds of nasty effects, and that's colonic dysbiosis or SIBO. And so there's not a big leeway in allowing those microbes to proliferate.
Let's talk a little bit about testing for SIBO. I think we know about tools like the Trio Smart. The Air device that you just mentioned is really appealing. My understanding is that they don't yet test for hydrogen sulfide, though. So they're looking for hydrogen, they're looking for methane from archaea. Could we potentially get a false negative with that option? Or as you kind of alluded to earlier, is there enough overlap between hydrogen, methane, and hydrogen sulfide? If we have an imbalanced microbiome, we would still pick something up with the Air device. And then building on that, in the book, you talked about some steps you wanted to do before using the device, stopping prebiotic fibers and things of that nature, certain foods to be avoided. Are we doing that to avoid false positives? What's the downside of not doing that prep step? It seems to me if someone has no issue, no overgrowth, that continuing to have prebiotic fibers and so on is not necessarily going to be a problem. But wondering how critical is that preparation to use that device?
Well, let's say you're eating just your everyday diet and you test randomly. You'll likely be positive. And that's because maybe you had some black beans in your omelet. Maybe you had some onions in your fajita, whatever. Well, those go to your colon where production of hydrogen gas is normal and expected. And so what you have to do is clear out those materials that would have caused your colon microbes to produce hydrogen gas. So it's 12 to 24 hours of nothing containing fibers. It's very restrictive. Nothing containing sugars, no alcohol, and a few other things so that you get rid of the colonic contribution to hydrogen gas. Then you have to do a baseline morning of testing after your fiber-free, sugar-free, alcohol-free diet. Test in the morning. If it's high, like above maybe 3 or 4, abort and try again. If it's low, let's say 1.2, that's where you can take the inulin. We use inulin. People use lactulose or glucose, which I think is not a good idea. Inulin's better because inulin is metabolizable by a broader range of species. If you use glucose, you metabolize a lot before it even gets to the microbes. If you use lactulose, not all microbes of SIBO can consume it. So inulin's much better choice. So like 2 teaspoons in coffee, and you can have your eggs or sauce or whatever else you want. Doesn't interfere. But test baseline with before eating. If it's low, let's say 1.2, 1.1, go ahead, have your inulin with your breakfast, and then test every 30 to 45 minutes, up to 90 minutes. You can go longer if you want. And if there's a rise of 4 or more units, that's positive. So the easiest way to think about this guy, I think, is to think of this device as a mapping device. It's going to, you're going to feed yourself inulin, and how fast hydrogen gas is produced tells you how far down it has to go. So if it happens at 90 minutes or 120 minutes, we can't tell if it's ileal or colonic. So you have to use some judgment. If you say, well, I've got fibromyalgia and I've got fat malabsorption in the toilet, I see fat droplets, and I'm having anxiety attacks, but I tested borderline, you've got SIBO. So there's some judgment involved also. And as you point out, if there's hydrogen sulfide producing overgrowth or methanogen overgrowth, it will conceal. You'll have a negative H2 testing. But if you have hydrogen sulfide overgrowth by the Trio Smart, or the newest version, hopefully in future of the air device, or overgrowth on stool testing of hydrogen sulfide species or methanogens, you know you have hydrogen producing SIBO also. It's just a pitfall of the test.
So it doesn't sound like the fact that the air device does not yet test for hydrogen sulfide creates a huge blind spot. It sounds like it's still pretty good at detecting SIBO from what I'm understanding. And then after you do that 12-hour break, which I guess you could do while you're sleeping for the most part, that makes it pretty easy, right? Then when you add the inulin, are you then also going back to your normal diet for the next several hours, or do you need to still restrict those other things?
No, you can eat anything you want. I mean, follow your usual diet. Don't eat garbage, regardless. But you can have your eggs and bacon, sausage, whatever else you want, and it will not interfere with the test. It's just that you want to not have fibers prior to that could have reached your colon.
H. pylori is a commonly discussed microbe that you say in the book has 2 faces. It has some benefits, maybe protecting us from GERD or acid reflux, weight gain, but it could also lead to ulcers and cancers. I've read some research suggesting that it actually is kind of educational to the immune system, that it can stimulate our immune system in a healthy direction. So should we be blasting H. pylori with triple antibiotic therapies, as many people do? Should we be balancing it with probiotics? Do you think the downsides outweigh the benefits? And is the super gut SIBO yogurt approach generally enough to manage H. pylori and kind of shift the balance back in the direction of benefit?
On balance, so, like many things, there's some good about it, there's some bad, but on balance, it's mostly bad. Because if it reduced asthma in a child, but gave you gastric cancer or Parkinson's disease or SIBO or colonic dysbiosis, it's probably on balance bad. And populations that have less H. pylori do better. And the SIBO yogurt will not eradicate H. pylori, but I do have protocols for eradication of H. pylori. We've had a lot of success with eradicating. And it's easy stuff too, Scott. It's really higher dose vitamin C, like 1,000 milligrams combined with black seed oil. You have to do several agents typically. And there's even a strain of rhodori, not the rhodori I use, but there's a different strain. I can't give you the strain designation, but there's good evidence that that strain of rhodori by itself eradicates H. pylori, or our rhodori can boost the efficacy of everything else you're doing. So this I have detailed in what I call an advanced topic in my website, mydrdavisinfinitehealth.com. But we have several protocols for it, and we've had a lot of success. It's actually quite easy.
And I love that approach because it never made sense to me to use triple antibiotics for H. pylori, which we probably aren't going to fully eradicate. We get it again from diet, other people in our household, whatever. And so, what's the downside of doing triple antibiotics and blowing out all the good stuff that you're trying to rebuild? So, I really like that. You mentioned earlier that berberine potentially is indiscriminate and may affect the healthy microbiome as well. Many of us, myself included, are using various herbal antimicrobials, maybe Coptis, black seed oil is certainly one of them. Many people use ozonated or oxygenated magnesium products for constipation. There's a lot of popular products in that realm on the market. You mentioned iodine earlier. So, do we know, are all of those negatively impacting the beneficial flora as well? Do we need to be concerned about that? Or is that far less of a concern than using a pharmaceutical antibiotic intervention?
So you can see that there's a lot of unexplored, unvalidated stuff out there. Maybe it has some positive effects. Maybe it's got some real severe negative. We don't know because, to my knowledge, no one's done the clinical trials and microbiome analyses. So we all have to be better at that. If I say, for instance, some ozonated product is good for this, well, can you show me the evidence and can you show me at least some effort at an outcome to see if people actually do better? And could you validate that with a microbiome analysis? Accepting that they have the same problem we have, which is we're not pharma. We don't rip people off. We don't charge them $12,000 a month, which they do for some ridiculous drug. So we struggle to validate these things, but they all suffer from the same thing, Scott: insufficient, inadequate validation.
Yeah, another one that I sometimes am concerned about is people consuming a lot of oral colloidal silver and wondering, what is that doing to the beneficial microbiome? Is it truly selective like some of the manufacturers say? I don't think we know. SIBO is more common than type 2 diabetes and prediabetes combined, as I understand. Those with SIBO may have 10 times more lipopolysaccharide or endotoxin that you've talked about. Those endotoxins can have a significant negative impact on our health, including contributing to neurodegenerative conditions. So, do the beneficial bacteria also create endotoxins? How do we mitigate those? We've talked about some of those strategies, but is the endotoxin reduction primarily by reducing those pathogenic bacteria that create it? Is it by supporting the lining of the gut, that intestinal hyperpermeability, to minimize transference from the gut into the bloodstream? Is there a place for endotoxin binders like charcoal or cholestyramine or Welchol? How do we think about reducing these endotoxins?
So if you just push down the enterobacteriaceae or proteobacteria, especially down from the small intestine, you can essentially eradicate endotoxemia. So my friend, Dr. Raul Cano, the microbiologist, he did a clinical trial with what they're calling the sugar shift commercial product, but it's Lactobacillus reuteri, Leuconostoc mesenteroides. I think it may have Eubacterium hallei and a couple other species. And they got just short of 100% reduction of endotoxemia. So the biggest I've ever seen. And so, but he did nothing for the mucus barrier except introduce those microbes. He didn't try to shift the Firmicutes to Bacteroides ratio or anything like that. Just seems like restoring beneficial microbes, even ones that don't take up residence. So Leuconostoc mesenteroides does not take up residence, for instance. Lactobacillus plantarum maybe, but that and pushing back Enterobacteriaceae and Proteobacteria seems to be sufficient to reduce, maybe even eradicate endotoxemia in the majority. One of the great problems we have, as you know, is the lipopolysaccharide endotoxin assay is not available to us clinically yet. It's available in like Raul's study, but it's not available. And our next study will do that also, but it's not available clinically, because wouldn't it be cool if you say, okay, I've done this. Is my endotoxin level now lower? Don't know. We can't measure it.
And is it reasonable to assume that beneficial bacteria do not produce a pathogenic endotoxin?
Some of them do, but it doesn't seem to be meaningful. And that's why we can see like that study where presumptively he restored a healthy microbiome, and he did do a microbiome analysis, and it was associated with virtually no endotoxemia. There's probably going to be some low level of endotoxin all the time because you do have fecal microbes and you probably want them in your colon. So even though E. coli, Salmonella, Campylobacter will make you really sick if you get fecal contamination of your food, or if it ascends into your small bowel, if it's in your colon, it's probably okay as long as it's not widely overproliferated. But do other species that have some measure of different endotoxins? That's the reason why, by the way, we don't have access to clinical testing for lipopolysaccharide endotoxin, is because the method of measurement is not is so the endotoxin of E. coli is different, say, from the endotoxin of Proteus, is different from the endotoxin of some Bacteroides species. And so there's not one test that identifies them all, and that's the reason why we can't get it clinically.
So many good things in the book Super Gut, and one that I was particularly interested in was the ALK-phos, or alkaline phosphatase. I think that is an intestinal enzyme that you talk about also being helpful for detoxifying lipopolysaccharides or endotoxins. Many people in the community of listeners, myself included, have consistently chronically low ALK-phos. We've done all the things. We've done the zinc. We've done the curcumin that you talk about. We've done the omega-3s. So for those people that have chronically low ALK-phos, how do we increase it so that we then are more efficient in removing lipopolysaccharides?
Don't know. So I don't know. And I don't know how well serum alkaline phosphatase is a reflection of intestinal alkaline, because having in general low alkaline phosphatase is a good thing in blood levels because it suggests you don't have biliary tract or gallbladder disease or bone disease. So that may be good, but I don't know how well serum or blood levels reflect intestinal lining levels. So Scott, just don't know.
I mean, this is part of what I love about this conversation. Number one, I love that you're willing to say you don't know, because I wish a lot of doctors over the years had just told me they didn't know instead of taking me down a specific path. And I love that you still have passion for figuring out what you don't know. That is so clear and
Oh, there's so
obvious.
much I don't know. I can tell you that.
So can we starve the bacteria in SIBO with a low FODMAP diet, or are we creating more problems than we're solving? Are we also starving the beneficial bacteria? And then maybe stated differently, is the FODMAP intolerance the root cause or a symptom of a different root cause?
Yes. So you can, if you're having bloating, diarrhea, panic attacks, asthma, whatever, from FODMAPs or from other foods, nightshades, fructose containing foods, fruit, legumes, whatever. The problem is not the food, it's the SIBO that's causing it. And if you went on a low FODMAPs diet or an elemental diet or a specific carbohydrate diet or some other deprivation diet, you will have a reduction in symptoms and you'll make the dysbiosis worse. And you may make it worse in a way you can never correct. Because if you starve those microbes because you failed to take in those fibers, some species will die and never return. So what if you lost your Fecalibacterium, the most important producer of butyrate in your GI tract? It's not going to come back. And so you reduce diversity, you lose up to hundreds of species. And even if you go off the diet, they won't come back. And so those diets are really, really bad ideas. You can do them for a brief period to obtain some relief, but to do it chronically is a really bad idea.
We think of SIBO as bacterial. There's also CFO, which is fungal. There's more people talking about CPO, which is protozoan or parasitic contribution as well. I'm wondering, with the fungal colonization piece, do we think that that is limited to the gut, or does it become over time a more systemic issue? Do we need to bring in some of the itraconozoles and fluconozoles, amphotericin, nystatin, those types of things? Or do you think that curcumin that you talk about in the book has enough antifungal properties to address more systemic fungal issues?
Boy, Scott, that's very perceptive because you raise an issue I have great concerns about, and that is exactly what you're saying. That is, if you have intestinal fungal overgrowth, colon or small bowel, do you also have it in your airways, sinuses, throat, skin, brain? Because it's become clear that people with dementia have brains filled with fungi. Now, it's not quite clear if there's cause effect. That's not clear. But I'll see this, for instance, in type 2 diabetics who have poorly controlled blood glucose. They'll have fungal overgrowth in the GI tract. They'll have fungi infection behind the ear, scalp, neck, under the breasts, groin, toenail, fingernail. Not enough has been done to see if those people also have brain overgrowth. But I worry that if you have fungal overgrowth, you likely have seeded the rest of your body. But that evidence, Scott, just not there. But I do wonder if this is true, because no one wants to get a brain biopsy. Go figure, right? But wouldn't it be cool to know if that's true? If you have fungal overgrowth and we can identify some marker in the brain that tells us you have fungal overgrowth, should we give one of those systemic antifungals that cross the blood-brain barrier to eradicate and maybe have an impact on your eventual development of dementia? No one's done that. Very tough study to do. Ruth Alonso in Spain is the closest. She's been doing brain sections in people who've died of dementia or other conditions. And the people with dementia have brains filled with fungi. But does that mean we should treat it before you're dead or before you have dementia? Just don't know.
One of the tools that we do have, which is not probably as good as hopefully we will have, but looking at fungal metabolites on an organic acids test sometimes will kind of show that pattern. And to your earlier comment, if we're trying to get rid of SIBO and SIFO, but we have bacterial and fungal overgrowth in our sinuses and in our oral microbiome, and we're swallowing that all the time, it seems like we're potentially just reseeding our SIBO, right? And so not thinking about those as part of a fuller, broader SIBO solution probably is not optimal. And when you're working with someone that's dealing with SIBO and SIFO, do you start with one and then work on the other, or do you do both simultaneously?
I have no proof that this is better, but I've suggested people do one or the other. Only because, not because of efficacy or danger, but because the die-off reactions are so unpleasant, or they can be so unpleasant. And if you did bacterial eradication concurrent with fungal eradication, you could be miserable. Nightmares, sleeplessness, anxiety, low-grade fevers, muscle aches, depression. It can be really nasty. And so I like to do them separately, only for that reason.
As much as this could be different from person to person, are you usually more inclined to address the fungal piece first?
Usually the bacterial, because it includes the reuteri for most of us. My first choice nowadays is the SIBO yogurt, reuteri gastri, either coagulans or subtilis. Because when you do that, I hope in the context of the other things we do, the diet and the nutrients, so that you're getting all kinds of wonderful effects. The wheat grain elimination is a huge contributor to overall health. And so you do the reuteri gastri and you say, oh, my skin is smoother. I'm more muscular. I feel stronger. I'm happier. I like my spouse better. I like my coworkers better. I get along with strangers. I'm seeking out the company of other people. Now you're happier, and life becomes a little easier that way, and you're stronger.
I mean, should anyone really be eating wheat, or are they just convincing themselves they're okay eating wheat?
Oh, it's one of the most destructive things you can possibly eat. So people think of it as a gluten issue. Well, there's truth in that. But it's so much more than that. The gliadin protein within gluten is, as you recall, yields opioid peptides that stimulate appetite. So it's impossible to control appetite while you're consuming those opioid peptides. The gliadin massively increases intestinal permeability. So lethal combination, wheat consumption from the gliadin protein and SIBO, lethal. You guaranteed big problems. What about the amylopectin A carbohydrate? Major cause of heart disease because it provokes extravagant formation of small LDL particles, the real cause for heart disease. And so that bagel, a week's worth of cardiovascular risk from that bagel because small LDL persists for 5 to 7 days. How about wheat germ agglutinin? Increased intestinal permeability, and also it is a bowel toxin. It inflames the gastrointestinal wall. It actually denudes the villi in your GI tract. How about phytates that bind? So as you know, as you well know, we're all mineral deficient. Phytates bind calcium, magnesium, iron, zinc, and others, and you poop it out in the toilet. So it amplifies mineral deficiencies and all their consequences. So wheat and grains are not suited for Homo sapiens, despite what the USDA tells us.
I agree. And then you have the whole glyphosate contamination on top of
Yes,
all those
that
other
too.
amazing things that you mentioned.
Yep.
So
Yep.
many of our listeners have dealt with mold illness from exposure in their external environment, their home, their school, their workplace, and potentially become colonized with some of these fungal organisms like Aspergillus. My mentor, Dr. Neil Nathan, talks about this. He suggests that we ideally optimize the external environment to be more successful working on the gut and our internal environment. Wondering how important you found it to be to look at the external environment if someone is not responding to the fungal interventions, that maybe their constant exposure externally is affecting them internally.
Scott, I'm not expert in that. I can only say that my anecdotal and occasional experiences have been, it seems to be a factor in a minority. And of course, the remediation of your environment is at least a part of the solution. I'm unclear on what we should do, and I'm just not clear.
All right, as we get into our last segment here, we're going to now talk about the yogurt. And quite honestly, as soon as we get through this conversation, I have some purchases to make because this is something I'm going to be implementing as well. In the book, you outline a 4-week process. Week 1 is preparing the garden, removing artificial sweeteners, emulsifiers, glyphosate, NSAIDs, PPIs, those types of things. Week 2 is planting the seeds with probiotics and fermented foods. Week 3 is watering and fertilizing the garden with the prebiotics, the fibers, the polyphenols. You talk about super fertilizers such as the eugenol from clove, FOS, oleic acid, capsaicin. And then week 4 is to grow your super gut microbiome with the yogurts. And the thing that kind of stood out to me, I wanted to talk a little about the capsaicin as a super fertilizer for the microbiome. We know we find it in hot sauces. Maybe people are not necessarily drawn to hot sauces. My understanding is it's fairly low in supplements, but are there other ways to get capsaicin into our routine to serve as that super fertilizer?
I think it might be modestly helpful. I'm not convinced there's a big effect here, but as you say, using hot sauces and peppers. I don't like the idea of taking. I think about people used to say to me, I'd say, extra virgin olive oil is your preferred oil for salad dressings and foods, and they'd say, well, I'm going to take it as a capsule. I'm going to take 50 milligram capsules of extra virgin olive oil. And they would pay extraordinary sums for it. And I'd say, well, it's a food. Just get it as food and enjoy it. So I think I'm not fond of the idea of taking capsaicin capsules or tablets, just getting it as food. But I'm not so sure it's that big of an effect.
So now we're going to talk about your powerful approach to making this microbiome nourishing yogurt, which, as you pointed out, is technically not a yogurt by definition because it doesn't have some of the organisms that officially qualify a product to be a yogurt. But you say that these can have 1,000 times the beneficial organisms compared to a probiotic or eating a store-bought yogurt product, essentially 300 billion per half cup of yogurt. I know there's a lot of recipes and slightly different variations in the book, but just at a high level, give people some sense for the process of creating a super gut yogurt. How do we do that?
So if it's just rotari itself, so the reason I made yogurt out of it was because the original product that was studied at MIT was the ATCC 6475 strain. I know I hate these numbers too. And that was a commercial product from BioGaia in Sweden called Gastrus, made for babies because they had good evidence to show it reduced infantile colic, fussiness, and abbreviated diarrhea a little bit after an antibiotic, and had some other beneficial effects in babies. So the dose was minuscule. It was 100. It sounds like a lot. 100 million of that strain and another strain. If adults took it, nothing would happen. It's a trivial dose. You'd have to essentially take the entire bottle. You wouldn't want to do that, of course. It'd be expensive and gross. So I thought, how can we amplify the counts? Well, you could have somebody make it in a factory, but I said, let's just make yogurt, or what looks and smells like yogurt. So I used prolonged fermentation. So rotarite doubles every 3 hours at human body temperature. So I said, let's try 36 hours, 12 doublings, and let's throw in some prebiotic fiber. It's like throwing cow manure on your garden. You can have bigger tomatoes, right? So I did that, and it worked. By the way, I called the company and I said, hey, I made yogurt with you. And they said, no, you can't. No one's ever done it. I said, I have. And back then I said, I'm on batch 30 and it's rich and thick. They said, no, you can't. And weird, very weird. So, and they blacklisted me, by the way. They wouldn't return my calls, wouldn't return my email. Very weird, very weird. So I said, all right. So I made the yogurt, worked out fine. We quantified via flow cytometry. We got something like 300 billion, as you point out, per half cup serving, 120 milliliters. But it showed me that, one, I went to a brewing store recently, and I'm talking to the brew guys there about their microbes for making wine and beer. And they said, what are you doing? I said, we're fermenting human microbes. And these guys are like, what? They were horrified. So it struck me, we're doing something very unique. So, but it struck me, if we can do this with rhodori, how about Bifidobacterium infantis? How about Lactobacillus brevis? How about Lactobacillus gasseri? How about Bifidobacterium longum? And so playing with it, and yeah, you can. And they all, by the way, have unique flavors and characteristics and effects. And some of the effects, Scott, have never been described. We're learning new lessons because it's all of us crowdsourcing all this wisdom. But then because the results of the rhodori were so over the top, that's when I thought, what can I do to give people some more relief from gas, bloating, diarrhea, all these things? So that's why I made the SIBO yogurt, the rhodori, gasseri, coagulants at first, now subtilis. And that has performed far and outstripped my expectations. I thought it'd be a little bit helpful. No, it has eradicated SIBO in about 90% of people who do this, as judged by the H2. But I don't want people to hear you need to get the air device. You don't. It's a wonderful device. I know the inventor, Dr. Angus Short in Dublin, Ireland. It is helpful, but you don't need it, especially since if the solution is something as benign as something that looks and smells like yogurt you make in your kitchen, it gives you better skin and muscle. You don't really need to be that confident.
I just had a conversation earlier this week with someone that was dealing with SIBO, and I said, hey, I have a podcast coming out on this that you're really going to want to listen to with Dr. William Davis, the Super Gut book, talking about creating these yogurts. And their immediate response was, oh, I'm really badly reactive to dairy. I couldn't possibly do that. Well, I know, and we'll talk about in a minute, it doesn't have to be dairy. But my understanding is that there's very little lactose that remains and that the casein is broken down. So if someone is dairy intolerant, is that really even a consideration for most people?
So as you point out, Scott, dairy has its issues. All we've done is minimize the issues. We've not eradicated them. So the prolonged fermentation allows the maximal conversion of lactose to lactic acid. If we were to check the pH, it would be about 3.5, which is 10-fold more acidic than conventional yogurt at 4.5. Well, that level of acidity denatures or breaks down the casein beta A1, unique to North America. And it breaks down at least some of the immunogenic sequences that are responsible for immune reactions with casein. We often pour off the whey, the liquid, because the whey is insulinotropic. It provokes insulin rises, or freeze it and use it as your starter. And so now there's other problems with dairy. There's other proteins, there's hormones, but with a half cup serving per day, we're just not seeing problems. And it's very rare to be intolerant to the yogurt because I believe of the prolonged fermentation methods.
So let's talk a little bit about the prebiotics that we then add to the yogurt making process along with the organisms. And let's just say half and half for now, and we'll talk more about that. But can we use things other than inulin in the yogurts? And how careful do we need to be that these products may be contaminated with things that we're actually growing organisms that we don't want in the yogurt?
I'm glad you asked because that seems to have been so. Most of us get this great, rich, thick end result. By the way, there's what we call the first batch effect. The first batch made from a probiotic tends to be thin and separates into water and curds. It's subsequent batches made from a little prior batch. It tends to be thick and uniform. So almost always we get, I've done hundreds of batches, never had a problem. But occasionally someone will say, I got this really stinky result and it separated. It was kind of gross, looked like cottage cheese. We didn't know what that was. So recently I sent off a bad batch for analysis. We're going to DNA sequence it and see what it is. But then a scientist friend of mine came to me and said, hey, Bill, the inulin you're talking about is not sterile. I said, oh, crap, you're right. So I went through the certificate of analyses of 10 commercial inulin from manufacturers. And lo and behold, he was right. There's almost no E. coli or those kinds of things, but there's bacillus species. We say COA, certificate of analysis, had less than 900 CFUs counts per gram of bacillus species. I thought, oh, crap. Now, in a tablespoon or two of inulin, that means only a few thousand microbes as compared to the billions we're using to start. So we don't use that BioGaia anymore. That's why one of the reasons I came out with a product of our own, because you get much higher counts, 10 to 20 billion per capsule. If you use only a single capsule, you can use more than one, of course. So we submitted that bad batch for analysis to see what's in it, but it's probably the bacillus species from the inulin. So I agonized over this, Scott, for months. What can we do? Can we expose to ultraviolet light? Well, you can. The problem with that is ultraviolet's wavelength, won't penetrate. Yeah, exactly right. And you'd have to lay it thin and have to expose for up to 3 hours in a sterile hood. Very impractical. You could expose to gamma rays. Well, people are going to object to that, right? Say, is it radioactive? Of course, it's not. But so we didn't do that. We found a source of sterile inulin. So we will verify it. We haven't yet had a chance. We'll submit it to the lab, have them run an analysis, verify that it has no bacillus species. Until that happens, there's some workarounds for people to do. One, you could try higher starting numbers. Don't use the BioGaia low numbers. Use like ours, like the My Rotary 10 or 20 billion per capsule. If you can even try 2 or 3 capsules if you want to start. Another thing to do is start your first batch or second batch, save the whey from that first or second batch, freeze it as ice cubes, cover it in plastic, and use 2 ice cubes for starting it. The reason for that is I think what's happening is if you had a little bacillus contamination at the start from the inulin, you make another batch from prior batch, another batch, prior batch, and down you've propagated the bacillus. So to avoid that, use the initial batch where there was almost no bacillus.
And you're not then adding more inulin. You're just using the whey from the initial batch?
And we are adding inulin.
Okay, so you're still potentially bringing a contaminant back in, though.
But we're not amplifying it via fermentation. Yeah, little weird. You could preheat it like 180 degrees Fahrenheit before you add the microbe. The problem with that is that doesn't kill bacillus species because they're spore formers. So you can do it, but I don't think it's going to work. So I think the solution will be either use those ice cubes of whey from the start or wait till we come out, I hope sometime soon, with what I think is a sterile inulin.
And I'm assuming that the bacillus in the inulin with the contaminants was not coagulans or subtilis, or we would actually probably be happy about that.
Yeah, there's a whole bunch of bacillus species. So inulin or other forms of, and inulin is the preferred fiber. Raw potato starch is probably even dirtier. It's a glucose polymer and Rotary does like it, but it's from potatoes. So it's probably even dirtier, right? Because you got potato skin contamination. So I'd use inulin. And until we get this issue worked out, it doesn't mean all your batches are going to be bad. I would say 95% of batches are just fine. It's occasionally someone, and it wasn't clear why that was happening, but I think my friend got it right. His name is David Worthen, PhD and patent attorney, by the way. And he says, Bill, the inulin's not sterile. I said, you're right.
So can you put the inulin with the liquid and boil it first before you add the microorganisms and then ferment it, or is that not a good idea?
The crazy thing with the Bacillus spore former, Scott, is you could pound it with a hammer. You could bake it. You could boil it. It doesn't die. It's real tough.
How would the yogurt turn out if the original microorganism, tablet, capsule, whatever we're doing, was not alive? We got some product and it was not alive, which is common. Would it then not turn into yogurt at all? Or how do we confirm the microbes are living? Is that because it actually ends up being more like yogurt?
When we saw a lot of that in summertime when it got real hot, and BioGaia was shipping tablets in hot weather, and we got a number, not a lot of people, but a number of people who had failed batches, and you essentially get soured milk. It's disgusting. It's inedible. It stinks. So that does happen. So what I'm hoping is our preparation with higher numbers to start, and we ship it on ice. So we during summer, nothing is perfect. If so, I've got delivered, say, to the Coachella Valley where it's 114 degrees, and the guy leaves it on your step, and you weren't home for another day or two, it's going to die. So we can't control that, but best we can, we're going to try to control it.
And most of the yogurts that you talk about in the book are about a 36-hour fermentation. Is it best to do a specific period of time, or should we assess the pH as a data point for when to stop the incubation?
You could, but you probably don't have to. So in the Super Gut book, as well as my innercircle.drdavisinfinitehealth.com website, we list the fermentation methods for each species. Most lactobacillus species can be fermented the same way. There's some variation, but it's not that important. So it's Lactobacillus brevis, Lactobacillus acidophilus, Lactobacillus rhodori. You can pretty much just use what we do, which is for some of those species, 24 hours is more than enough. For some slow growers like rhodori gastrite, 36 hours is better. But if you took a fast grow and let it go 36 hours, nothing bad will happen. So you can do that. Bifidobacteria likewise ferment much the same. And then there's some exceptions, like Lactobacillus plantarum. You can ferment almost at any temperature. So no one has to memorize that. It's in the Supergut book. It's in my website. But it's only important, of course, if you become a fermented crazy person, want to ferment all kinds of microbes.
I mean, I hope ultimately you come out with an extension of your product line that has the majority of the things people need, because I think then we have more confidence in the sourcing, that it's being used for this specific purpose. I think right now, it's a little challenging with people trying all kinds of different things. And with your research and particularly looking at like this sterile inulin and so on, I'd love to see a whole line of super gut products that come out under your leadership.
Oh, give it time, Scott. Give it time.
So when we're making these super gut yogurts, let's talk about the quote milk. Is it best to use A1 dairy, maybe A2 dairy? I think we're usually talking about half and half. What about the risks of raw milk, particularly with the organisms that could be in there and fermenting those and maybe not knowing? And then what about nut milks or coconut milk? Do we need to do anything to pasteurize them or sterilize them to some extent? Talk to us about the various options for the liquid.
Well, first of all, I reject this idea that we should limit fat or saturated fat. Fat's the most healthy part of the dairy. There's some problems with dairy, but not the fat. So we see all this garbage skim milk 1% nonsense. So I used half and half, 18% fat, because it yields the best end results. Thick, it's rich. You can use whole milk. It does help to preheat because it makes a better mouthfeel, but it'll be thinner. You could use cream, but it comes out like cream cheese. And I think it's just too thick. A1 milk, casein beta A1, if you don't have an reason to believe you have an immune response to it, is fine. And of course, we're breaking down or denaturing much of the casein with that acidic pH. If you think that casein is an issue despite prolonged fermentation and acidification, then casein beta A2 or goat or sheep. Actually, human milk, I've had people make it from human milk, believe it or not, which is A2. It's kind of weird, but anyway. If you choose to make with coconut milk, there's a couple of extra steps you have to use because coconut likes to separate. It has to be canned coconut milk without addition of emulsifiers, except for guar gum. So we have to add guar gum, like a teaspoon per can, and hit it with a stick blender for at least a minute. And that will inhibit the separation into protein and fat. So that helps too. I don't think you have to sterilize again after pasteurization or ultra pasteurization, unless you're using whole milk and want better mouthfeel. But it's highly unlikely you have contaminants. Now, raw milk's a problem, which is a shame because raw milk has beneficial microbes in it, but can also have listeria or Staphylococcus aureus. In Minnesota, where it's legal for people to sell and consume raw milk, and every year there's a couple of dozen deaths in children who consume their family farm's raw milk. Now, when you ferment raw milk, even if there's a little bit of listeria or staphylococcus, it's going to get amplified by the fermentation process, and you potentially make it a very dangerous thing. So while raw milk in theory is a good thing, better thing, if you ferment it and increase microbial counts of pathogens, that's where it makes it dangerous. So you shouldn't do that.
And if we're not using a pasteurized product, we're using coconut or we're using some other non-dairy product, do we need to boil it then to remove any potential contaminants or not?
It's optional. There's a rare contaminant in coconut milk. And I forget the name of the microbe. It's rare. But if you get it, it's bad. You get real sick. So the risk is less than 1%, a fraction of 1%. So is it worth it? I think it is, just to be extra safe, because, especially depending where you got it. If you got it from Malaysia or someplace like that, where maybe production methods are a little, so I think it's probably wise to boil it for a couple of minutes beforehand, before you add the microbe, but it's optional.
Does the consumption of a large number of copies of a small number of organisms have the potential to also lead to an unhealthy shift in the microbiome that's more of a monoculture? And then extending on that, how do we optimize the microbiome in the direction of increased microbial diversity? I know Kiran Krishnan would say that the bacillus spores actually do serve as keystone strains that help with diversity. But with these approaches, are we seeing increases in microbial diversity as well?
That's where fermented foods, Scott, shine. The kimchi, kefirs, yogurts, fermented veggies, pickles, those kinds of things, they really help with diversity. We base that judgment on the Sonnenberg study, the Justin and Erica Sonnenberg couple at Stanford. They did that study where enthusiastic intake of fermented foods was the thing you do for increased diversity. So that's what really matters. I've never seen anybody get even close to a dominance of one microbe, unless it's a pathogen. A nasty pathogen like C. diff. Barring that, I've never seen evidence that, let's say, a Lactobacillus gasseri or a Bifidobacterium longum or something like that would become dominant, because there's really, even if so I've taken up to 1 trillion Lactobacillus rhodori, nothing happened, because you have hundreds of trillions of microbes in your GI tract. And so what we're doing is actually small numbers, believe it or not.
Plus, as you were saying earlier, most of these don't initially colonize. So even if you had more of one that you were taking from the yogurt, that wouldn't necessarily persist after you stopped its consumption for a long period of time, right?
Hey, let me throw something out at your audience. Just a wacky story. It's a little embarrassing, actually. So I'm doing the rotary, and one night I have this dream, and a woman comes to me, and I could see her in vivid detail. Scott, this has never happened to me before. I could see her auburn hair, her hazel eyes, big, beautiful smile. And I felt overwhelming affection for this strange woman. And she introduces herself, first and last name. I've never had that happen before. First and last name. I wake up. I had this feeling of overwhelming affection for this woman persist, intoxicating into the day. I know, what the heck is this? Is this some kind of an amplification of the oxytocin effect, right? So I look back over what I did. What did I do different? I could not figure it out. So I tried a whole bunch of different things, including consuming 1 trillion rotari. And I did not experience it. One time I came close, and I still didn't know what it was I did. But if that's an effect that we could provoke, is it worth understanding how and why it happened? And if we could, what we do with it? I don't know. Would you use it for good or evil?
So, in the population of people listening to us today, they tend to be more sensitive, ultra sensitive. Many have SIBO. If we're thinking about the super gut SIBO yogurt with the L. reuteri, L. gasseri, and Bacillus coagulans, or maybe now subtilis, would it make more sense to start with each one of those individually, see how you respond, versus starting with the trio of those all at once in a more sensitive patient?
That would be reasonable. I would opt, though, for the Reuteri, gasseri, Bacillus subtilis, one of those three or two of those three, just because we know the potential benefits are so over the top because of those characteristics: small intestinal colonization, bacteria and production. Let's just say you make the gasseri and half a cup a day gave you diarrhea and anxiety. Cut it back to a couple tablespoons or even a tablespoon. And then maybe build it up to 2 tablespoons over a few days and 3 tablespoons. And then, you know what I mean? People can do that because, we're not talking about drugs with nasty side effects like liver failure and opportunistic infections. We're talking about something that looks and smells like yogurt that has spectacular benefits. Like the gasseri, we know with good evidence, shrinks your waist. It's not huge. It's only maybe a couple inches. But you're not exercising. You're not changing your diet. You're just getting a microbe. And it's probably, by the way, by reducing endotoxemia. Probably. No one's done that study yet.
In the book, you talk about Lactobacillus reuteri, very specifically ATCC PTA 6475 and DSM 17938. So very specific details because, as you point out in the book, different types of these organisms have very different resulting effects. We're no longer talking about the BioGaia Gastris product. You mentioned you now have created the Oxytocin My Reuteri product, which is L. reuteri LRDR. And I know people have asked, what strain is LRDR compared to all of those that you talk about the specific benefits in the book?
So one of the goals I have is to optimize this whole phenomenon. And one of the questions is, of the 200 plus strains of Reuteri, are there any strains better at these effects than another, say 6475? And so far, we've only compared 5 because of budget. It's very expensive to do this. And so far, we've not been able to tell any difference. They all seem to be the same. And so the LRDR in our hands, in animals and in humans, is equivalent. Now, we're repeating the animal work. We got more human work to do. What I hope to say in, I don't know, a year or two, I say, Scott, we found a new strain, ABC123, whatever, and it's 40% better in provoking oxytocin. It has better intestinal adhesibility in the small intestine, and it produces 4 bacteriocins rather than 3. But right now, I can't say that because we hadn't had enough time and money to do that kind of thing, but we're trying to do that. So right now, LRDR, I think, does all the things we want it to do.
And is LRDR, is that something proprietary to your formulation, or is that something people can go look on PubMed and find out about?
No, it's proprietary. One of the things that happens, you may know, when you're involved in a commercial project and you file multiple patents, you got to kind of, because if you talk about it, at least in U.S. law, you run the risk of invalidating your patents.
Coming back to the Bifidobacterium conversation, is the yogurt an effective way to create a broad Bifidobacteria? I know in the book you talk about using yogurts for Bifidobacterium infantis, which is usually missing more, we think of more in infants. I actually, as part of my attempts to restore my microbiome, have taken the Bifidobacterium infantis probiotic product that is commercially available. But is there a way to create a fermented Bifido yogurt material that has a broad number of different types of Bifidobacteria?
Oh, yeah. But with the one caveat, remember, is if you make subsequent batches, we don't know if there's a shift. Does one become dominant? Does one die? We just don't know. I'm going to predict that they're roughly, if you start with a third, that by your 5th batch, you still have more or less a third when you're using the same genus, Bifidobacteria. But Scott, I don't know that for a fact. It's you can imagine there's so many iterations of this stuff. Combine Lactobacillus brevis with Lactobacillus rotari, throw in some Bifidobacterium longum, throw in some, how many, because each run to do that analysis is a couple $1,000s. So you can only do that so many times before you run out of your budget.
Coming back to the more sensitive patient, the mast cell patient, the histamine patient, it's not uncommon for probiotics, fermented foods, kombucha to flare that population. We know that we now want to think about, well, have we done enough to address SIBO as a way to improve tolerance? But if we take the SIBO off the table, do you find that people that are more sensitive in that mast cell population, are they usually doing pretty good incorporating these yogurts? Do you have them start with a teaspoon and work up? What's been your observation?
My anecdotal observation is that there's no such thing as histamine intolerance when you eradicate SIBO. Now, maybe that is a rare person. So if this was grandma's day, maybe they didn't diagnose it properly, but nobody had histamine intolerance. So I think that's what's happening. We're reverting back by correcting the SIBO and perhaps other things. We're reverting back to the way that our grandparents and great grandparents had it, where food was something great and great grandma didn't have to say, I can't eat those 37 foods because they cause histamine reactions. So, and I have not seen histamine intolerance persist with these efforts.
On the Bacillus coagulans yogurt, that's a spore-based bacteria, as I understand. And then extending on that, the product that we talk about in the book has maltodextrin, titanium dioxide, carrageenan, magnesium stearate, silicon dioxide. That's another reason why I will love eventually when we can get these clean products from you, because looking at the ingredients in that product, I personally wouldn't take it as a supplement, let alone using it then to make a yogurt. I think carrageenan was one of the items that we talked about earlier as an emulsifier that we ideally want to avoid, granted, probably in a small amount. I dug for about an hour or two, reached out to my community. I finally found a BC30 product from a company in California called Gluten Free Remedies that appears to be very, very clean, and wondering, is there any reason not to experiment with other products?
No, I love when people experiment on their own, but something to know. So I wish those companies were smarter and didn't put crap ingredients. But let's say you take a capsule with some crap ingredients, you make your first batch, it's dilute because you're using maybe a quart, say, of dairy, so it's very dilute. Then you make your future batches from a little of the prior batch, it's even diluted more. And every time it's virtually gone by the second or third batch. So at a practical level, it's really not much of a concern.
There is some discussion around Lactobacillus neurale PS128, which is a Lactobacillus plantarum and has potential benefits in Parkinson's. Wondering if anyone's experimented with using that as a yogurt in the Parkinson's population.
I hadn't with that specific strain, but with Lactobacillus plantarum is very fermentation friendly. It will ferment on your kitchen counter at room temperature. It'll ferment in a hot kitchen at 85, 90 degrees. It'll ferment at human body temperature. It's really a versatile organism. And it has some pretty good effects too. It's really good, for instance, ladies love this. You know how ladies are. They want better skin. And it's a great skin product, improves skin, and it has gastrointestinal benefits. And if we believe Martha Carlin's line of reasoning, it may be instrumental in Parkinson's disease presumptively from the consumption of sugars and converting to mannitol that preliminary evidence suggests dissolves the alpha-synuclein in the brain. So, plantarum is a great microbe, Scott.
Can we make the yogurt and then, in order to kind of extend its life before it maybe goes bad, freeze it like you talked about in an ice cube tray or something, and rather than using it as the starter, just pop one or two of those out every day and consume that? Or does freezing it have any negative effect on the number of organisms that are in it?
No, freezing microbes are very happy to be frozen. When we order microbes from a manufacturer, for instance, we get it frozen on nitrogen dry ice. And so that's how they do it in manufacturing. They lyophilize it, they freeze dry it. So microbes are they don't tolerate heat, but they do tolerate cold. And so you can make the yogurts and they make delicious, like chocolate frozen yogurt or berry frozen yogurt. I've done that many times.
So if you were going to do some flavoring, chocolate, blueberry, vanilla, whatever you wanted to add to it, is that something we'd want to add after the fermentation process, or is there any type of flavoring that can be added in earlier?
There is, but we don't know the effects because there's so many different ingredients. Some ingredients have antimicrobial effects. If added at time of consumption, it's probably not a big issue. One of the recipes I shared with ladies in one of my private Facebook pages was I have a private Facebook page for skin health because of the gut to glow. And one of the things I was contemplating is, I hate, Scott, women are ripped off by the cosmetic industry. And I see them doing outrageous things like being charged $120 to $180 for a vial, a 1 ounce vial of, let's say, vitamin C serum or retinoic acid serum or something like that. I know they can make that for a few dollars. So I try to educate ladies in ways to not be exposed to that kind of profiteering. And one of the ideas I had was, we know that topical vitamin C is very beneficial for ladies. It increases dermal collagen. Well, rather than pay $180 for a 1 ounce serum, why not put papaya, pureed papaya, quarter half cup into your mixture prior to fermentation? You get great vigorous fermentation, you get papaya flavor, and it's very concentrated in vitamin C because papaya has a huge amount of vitamin C. And ladies can consume it and can also apply it topically because the concentration of vitamin C provokes dermal collagen even further. And so far, a handful of ladies have done it and love it. So there are things you can add, but in general, it's better added at time of consumption. Unless you tell me exactly what they're thinking of doing, because all different ingredients behave differently.
And I think papaya is also prebiotic, right? So it's also helping with the fermentation itself.
Very good. Yes, that's right.
So if someone is taking the yogurt, but they're also on an herbal antimicrobial or maybe iodine, like we talked about, should those be separated throughout the day, or do we need to be off of those antimicrobials for the full benefit of the yogurts? How would we do that if we still are using some herbal antimicrobials?
You can take the herbal antimicrobials with the yogurt, but it's going to kill the yogurt microbes. So it won't harm you, but you won't get the benefits. Because like the berberine, say, in a lot of those preparations will kill off the reuteri and some of the other beneficial microbes. And so it doesn't hurt, but you're not going to get full benefit. So I prefer, if they're going to do herbal antimicrobials, do the herbal antimicrobials, finish it, then do your yogurt. Now with iodine, we know that iodine's antimicrobial. So we don't know how meaningful that is, though. So just to be safe, I tell people try to separate them maybe by 4 hours or so. If you did your yogurt in the morning, maybe wait till the afternoon to take your iodine or vice versa.
One of the bigger debates in the online community is which yogurt maker to use for this process. I've seen a lot of conversation around the Ultimate, the Louvel, the different sous vide devices, and even the Instant Pot. Is there a standout from your perspective that makes the batches most consistently the way we want them to be?
The two yogurt makers, the Louvel and the Ultimate, are two good choices. They have adjustable temperature and timing, and they've been they're not foolproof, but they're pretty good. The Innova sous vide is what I'm familiar with. The stick sous vide, has served me well. It's loud, but it does work well. You have to get a basin with it. I've used two basin sous vides. I lost faith in those because I saw them both overheat dangerously. One time I left the house to run an errand. I come back, it's 180 degrees and smoking. And who knows what would have happened, So luckily I came home. So I stopped using basin sous vides. I'm told, I've never used an Instant Pot, but I'm told that the newer devices that have a yogurt setting are pretty good. But I believe they're preset to, I think, 104 degrees. And some of the old devices cycled like between 90 and 120. So that killed a lot of microbes. So I'm not sure, but I don't think the older sous vides are very good. But I'm just not that familiar with the Instant Pots to know.
One comment that I'll just throw in here, not necessarily a question, but kind of coming back to the conversation around mold in the external environment. You talked about the potential contamination of the yogurt from non-sterile inulin, but I know you have also mentioned that we need to be cautious about making this around our HVAC ducting system that could be harboring mold and fungal organisms, because whatever gets in there is then going to be fermented. So that's another consideration, particularly if we know, like many people listening today, that are living in a moldy house. We want to be a little more careful than if that were not the case.
It'll be obvious, Scott, though. It'll be pink, orange, or green, typically discoloration, sometimes black. So, in other words, it's not invisible. It's very obvious. Just scrape it off, toss it, and you can still eat the yogurt, though.
It'll be interesting because now my community will be using that as a new mold test for their home to see if your yogurt turns different colors. So when someone starts to incorporate these fermented products, we talked about the potential for a Herxheimer reaction, a die-off reaction. What are the most common symptoms that they may see that they're kind of cluing them into maybe they're having this feeling worse, this Herxheimer reaction? And then would you reduce the amount of ferments? Would you have them take activated charcoal? What do you do when someone has a die-off reaction to the yogurt?
Yeah, the emotional effects are very unpleasant potentially. It's anxiety, depression, dark thoughts, occasionally suicidal thoughts, panic, racing heartbeat, sometimes less commonly, low-grade fever, muscle aches, a disruption of sleep, insomnia, nightmares, hatred, anger, violence occasionally. I mean, these are real effects. If you get that, it scares you, and as you say, reduce the intake of those fermented foods to a lower quantity. So, rather than a half cup, say maybe a tablespoon or two. Activated charcoal does work. We learned that in our audience, my group, that 1,000 milligram capsules of activated charcoal used as is or as needed, because it's not good for you. It's not dangerous, but it binds nutrients. So 1,000 milligrams in a capsule, because it's really messy as a powder, and it works within 15 minutes. We don't use the diatomaceous earth because a lot of products have lead in them, and that's worked pretty well.
Do we think that eventually some of these organisms will colonize the gut and then we don't need the yogurts anymore? We maybe don't need as much fermented foods? Or is it likely the case that they will continue to be transient, that we'll need to continue to introduce them through the yogurt daily and lifelong? And then you've already commented that even if they're transient, we get a lot of benefit, but how long do we need to think about doing the yogurt before we hope the benefits are more persistent?
So, as we mentioned earlier, until we figure out how to make them take up permanent residence, do it for the next 70 years.
We touched on this briefly earlier, the whole idea of FMT or fecal microbiota transplant, which really is only available for people dealing with C. diff in the United States. But do you think that the concept of FMT could lead us to better solutions in the future, maybe better probiotic products? Can we get to a point where we can get the benefits of FMT without the very real potential downsides?
I think so. I don't know so. To my knowledge, no one said, okay, here are the 18 species in presumptively normal stool that are the workhorses that generate all the benefits. To my knowledge, no one's done that. And of course, there have been some adverse events because while they screened for HIV and hepatitis B and C and some other things, they didn't screen for SIBO and some other things. And so some people got really sick with their FMT. So there's clearly, it's a work in progress, but I'm hoping it does. I don't think it's necessary in the vast majority of cases, because what these people who opt for FMT are often people who are given a probiotic at most or an antibiotic, but weren't told all the other things we're talking about: restoration of keystone species, fermented foods, cleaning up your lifestyle. It wasn't done because almost nobody does that, right? You go to heaven forbid, you go to the GP or gastroenterologist's office, you won't hear any of this stuff, right? And so I'm a little skeptical that FMTs are that necessary in the majority of cases. There are people who are very sick and would benefit, no question. But I do hope it does provide some new lessons.
some better crapsules or poopsicles, I guess, in the future. All right, two more questions before we wrap up. So talk to us about some of and we already touched on a little bit of this, but talk to us about some of the products that you've created that you're working on to support and optimize the microbiome. What lies ahead from your perspective in terms of microbiome research, and what do you see as the future of microbiome medicine?
I think we're still in the world of what I call probiotic 1.0. It's okay, Bifidobacterium infantis seems good. Throw that into the mix. Lactobacillus brevis, we think that's good. Throw that in. This haphazard slapdash method of concocting probiotics, and also mistakes being made. There's a product, a lot of money was spent for double encapsulation to delay its release into the colon. Well, no. If much of the problem is coming from the small intestine, you don't want released into the colon. So a lot of mistakes being made. So I hope to get beyond some of those basic mistakes in the early years. I think there's going to be a lot of cool things coming out. The combination of microbes with non-microbial synergistic components, the encapsulation of species, not Akkermansia, but Akkermansia-like, so-called obligate anaerobes that we can protect. So people who've lost Fecalibacterium, for instance, what if we can get Fecalibacterium, coat it so it doesn't die upon exposure to oxygen? For people who, for instance, made the mistake of going ketogenic or carnivorous or low FODMAPs or whatever and lost Fecalibacterium, such an important microbe, but you can't get it as a probiotic because it dies. What if we could coat it in some way and get it to you when you've lost it? So a lot of innovations like that. And I think there's going to be a lot of innovations coming from the issue you raised way on in the beginning. That is microbes unique to specific locations, mouth microbes, vaginal microbes, prostate microbes, endometrial fluid microbes that right now we don't know how to do that with an oral product. But this is all starting to get exposed to light now. So it's really a cool time, Scott. It's really cool. Great stuff coming out, but we're still in the beginning stages.
My last question is the same for every guest, and that is, what are some of the key things that you do on a daily basis in support of your own health?
I try to get Rotary at least every other day. I take that thing I created, the Gut to Glow, because I'm a little lazy when it comes to hyaluronic acid and carotenoids. So that makes it easy. I also I just call it sloppy. It's collagen coffee. I make coffee and I throw in a big scoop of bovine collagen. Nobody knows what the ideal intake of collagen is. And it is tough to, eat tough cuts of meat every day and eat skin and all things. So I do that. I never limit fat. I love eggs despite their price. But nothing magical, Scott. A lot of the same things we talked about. I don't take probiotics, but I do get a fermented food at least with every meal. And most of us in my community tend to eat twice a day. We have a late breakfast and then maybe an early dinner, not because we're cutting back on calories, just because we're not hungry anymore.
Amazing. This conversation was just remarkable. One of the takeaways for me was really the importance of hyaluronic acid, and I was familiar with it, but for some reason I didn't really understand it to be a fiber. And so a lot of the things that you talked about there lead me to wanting to go explore that. I am going to be starting to make some of your yogurts as well, and hope people in my community will also do that. You are so generous with your time. I think this ultimately will end up being a two-part episode because we've talked for over 3 hours, and we really have.
Gee.
And I absolutely loved it. This was kind of like going to the Toys R Us for me and just having all of these great things that you had to share. It was very empowering. And if it wasn't for online censorship, I would say you are the bleep.
You are very thorough, Scott. What is your background?
So I guess I would just say I'm a seeker with great curiosity.
Okay, because you're very curious and you're incredibly well-read.
To learn more about today's guest, visit williamdavismd.com. That's williamdavismd.com. williamdavismd.com. You'll also find the links to the products we discussed in the show notes. Thanks so much for listening to today's episode. If you're enjoying the podcast, please leave a positive rating or review, as doing so will help the show reach a broader audience. To support the show, visit betterhealthguy.com/donate. To get my newsletter, visit betterhealthguy.com/newsletters. To follow me on Facebook, Instagram, X, or TikTok, you can find me there as Better Health Guy. This and other episodes can be found on Apple Podcasts, Spotify, Amazon Music, YouTube, and Odyssey.
Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.